Some perspectives I'd like to share, because I'm a self-diagnosed or identified autistic ADHDer. That doesn't mean that I'm not actually getting support. I have a psychologist who I found, and I went to my first session and I said, I want to explore my ADHD and being autistic without a diagnosis right now. So I think, given that there are a lot of barriers to getting a diagnosis, for example, cost, waiting times, even finding a neurodivergent affirming psychiatrist, I think it's important that health practitioners, medical practitioners, mental health professionals can support people without needing the diagnosis. Because I think, what kind of neurotypical person says, oh, I think I have ADHD or I'm autistic? We spend hours researching it, hyperfixating over it, and it's like, oh, okay. So I think, to me, self-diagnosis and identifying is valid with research that comes with it, not just watching one TikTok and saying, oh shit, I have this.
Yeah, I think that's really important. I'm also self-identified with autism. So for me, it was personally actually very interesting, because I saw the traits in my clients first and then I recognized it later. So in that aspect, being a person of color as well, and having a lot of those insights, and also imposter syndrome, and really wondering what is actually going on. Is it or is it not? And in that space, trying to figure it out, I think preserving your energy and being able to self-identify and saying that's enough for me, and I can, have the supports and things from family, community, that's okay for me. And I think that's why it's so important for it to be more valid, that it is okay to identify yourself, but also receive support around it.
Absolutely. I'm going to completely agree with that too. Yeah, I think self-identification is so important. I think probably where I'd kind of extend that is that I think it's not, self-identification is really valid and really important, and there are some really valid reasons sometimes why you might go on to sort of formalise it. So I self-identified first, and then went on to have that formal diagnosis, because I was questioning myself, having worked in the field for a long time. I wanted to make sure that another professional could see what I saw. But yeah, there's so many really valid reasons to self-identify, and there's some really important ones sometimes too to go on.